Women are the bedrock of any society. They are the givers of life, and they play many roles in our society. They are wives, mothers, doctors, lawyers, economists, judges. Indeed, any field a man can excel, a woman can equally excel. Despite these factors, women still face a lot of challenges when it comes to gender equality. The statistics are outstanding. Women make 22% less than men when they are of comparable skills and employed in comparable positions. 35% of women worldwide have experienced either physical or sexual intimate partner violence or non-partner sexual violence. Women in urban areas are twice as likely as men to experience violence, particularly in developing countries. Women and girls represent 55% of the estimated 20.9 million victims of forced labor worldwide, and 98% of the estimated 4.5 million forced into sexual exploitation.
When you talk about equality, it's not there at all. You go to homes, the girls are brought up to be subordinates. That is how they are trained. That is how the Nigerian society see women. That is how the world see women. Women are trained to be subordinates. Women grow up knowing that they are not first.
In certain part of the country, women are not allowed to do so many things. They are relegated. They hardly go to school, and child marriage is in practice. Female genital mutilation is in practice, and access to education and to good health are all things that women and girls have to contend with in Nigeria.
One of the biggest areas of vulnerability for women has to do with their reproductive health and rights. In the sub-Saharan African region, no sector exhibits the inequality between men and women more than the health sector. Every day, approximately 800 women die from preventable causes related to pregnancy and childbirth, and 99% of these deaths occur in developing countries. Cultural practices and ignorance help contribute to this trend.
It is the norm. Women are born as inferior. You give birth and they say it's a boy. Everybody's shouting, it's a boy, it's a boy, it's a boy. You say it's a girl, they say, we thank the Lord. That's it. There's no fanfare, there's no jollification, so to speak. It's like that from birth.
Practices like female genital cutting, early marriage, and inadequate education on sexual and reproductive health all contribute to making the playing field less level for girls and women. Addressing gender inequality and empowering women requires strategic interventions at all levels. Strategic intervention driven by research and evidence-based advocacy and targeted interventions that will better the lot of women. Several attempts have been made at addressing the issue of women and placing it on a global agenda.
And one of the things that were lacking in the 90s, early 90s, which the International Conference on Population and Development in Cairo 1994, and following that, the Fourth World Women's Conference in Beijing 1995 sought to address was the silence, the relative silence on the part of society and on the part of government at addressing some of these issues because of their apparently controversial and sensitive natures.
One of the many civil society groups and non-governmental organizations that have been working to improve the lot of women in Nigeria is the Women's Health and Action Research Center in Benin City, Nigeria.
The Women's Health and Action Research Center actually started as a unit at the Obafemi Awolowo University in 1993. It started as a Women's Health and Action Research Unit, which was basically to conduct research into women's health-related issues. Prior to 1994, issues related to women were mainly discussed from point of view of family planning, the need for women to regulate their childbirth without necessarily addressing the other needs of women. So we became aware that most of the issues of disempowerment that affected women were more concentrated in Africa. At that point in time, they made comparisons between developing and developed countries and between the various regions of the world. And it was very evident that African women suffer the greatest level of disparity and inequity. And so we just felt that there was a need, especially because governments were not focusing on this issue. There was a need for non-governmental organizations to take on the gauntlet to be able to concentrate on empowering women and building an understanding of stakeholders to understand the needs of women.
So WHARC rose up to the challenge by saying if we bring scientific evidence that is very difficult for anybody to fault, then our people, our governments, the various NGOs will see the magnitude of the problem and the need to do something about it.
For more than 20 years, the organization has worked to bridge the gap between women and men in the sub-Saharan African region.
We basically exist to promote the health and social development of women and equality of women with men through research, through advocacy, through service delivery, and through training of relevant stakeholders on these various issues.
Since its founding, WHARC has achieved significant strides in the fight to promote a more equal and inclusive society for Nigerian women. The numerous achievements of WHARC over the years were made possible by a dedicated and committed board of trustees who oversee the activities of the organization, and an effective leadership team leading a group of qualified and passionate staff.
To ensure that we get people committed, we employ mostly women. 80% of our staff are female. Some of them are already mothers. Others are single girls who one day will become mothers. So to that extent, they are committed to seeing that we promote sexual and reproductive health.
We expect our staff, the board, the management and staff, to excel in these areas we've outlined, which is our focus, reproductive health, that we are at par with the world in making sure that our women, they are aware when they are pregnant, what they should eat, what they should do, and when they have children, how they should look after them. So we expect the board, management, staff to be aware and to, in their advocacy, you'll be telling the world, this is what we're doing, come to us, we'll be able to advise you.
One area that WHARC has made significant impact is in the area of maternal mortality. And this has been a consistent focus on WHARC's work since its founding.
The many reasons that there's a very high rate of maternal mortality in Nigeria is because of first of all, I will call one of them the primary reasons, being the fact that when women get pregnant, they often don't receive care from relevant health institutions. And more importantly, women who don't have to be pregnant still get pregnant. So if those who are not supposed to get pregnant and they are at risk of carrying pregnancy because of some other problems, then they run the risk of dying during pregnancy. Secondly, when women get pregnant, they often don't seek what I would call evidence-based care, antenatal care. They are supposed to go to the clinics to receive care during pregnancy. Today, it is known that only about 30% of women who get pregnant in Nigeria are attended to by skilled birth attendants. So many women are attended to by traditional, what I call unskilled birth attendants, or that traditional birth attendants, as well as some of them delivering even at home unattended. So with that scenario, you'll be sure that many women will not be able to survive when they experience complications.
Unfortunately for us, the courses are no longer the medical courses. In medical courses, it's easy. I will tell you, obstructed labor, ruptured uterus, hemorrhage. That's hemorrhage during delivery and so on. You know the things that make women die. A woman who has a ruptured uterus will die if she cannot get an operation immediately. A woman whose baby is obstructed in the passage will die if she cannot get a cesarean section to relieve that obstruction. A woman who is bleeding while pregnant, while trying to deliver, just after delivery, will die if she cannot get blood transfusion immediately. A woman who is infected after delivery, sepsis, will die if she cannot get antibiotics. A woman who's convulsing, has eclampsia, will die if she cannot get anticonvulsants. We know that.
So the reason they die is not because of the high presence of these complications, but more importantly because these complications are not adequately managed. Women do not go to the right places where they can be adequately treated and receive treatment. Our health systems in Nigeria is still very, very weak, one of the weakest in the world. There are many inadequacies that have not been met. Emergencies obstetric care, where women are promptly treated when they have complications of pregnancy, is very, very poor.
For the past 20 years, WHARC has been committed to reducing maternal mortality in Nigeria.
Over the years, we've worked in some states, worked in Ondo State and in Edo State to provide them with suppository. That's a drug to reduce postpartum hemorrhage. That's in countries, helps in controlling third stage of labor. So it prevents maternal mortality during that stage.
And they have been doing this through research and influencing policy.
We've worked in 6 states of Nigeria: Borno, the Borno State, Lagos, Plateau, Cross River, Enugu, and Kano. What we actually worked on increasing political realness and reducing maternal mortality. We did a needs assessment survey to find out the policies on ground in those states, the cost of rendering maternal health services there, and a lot of we looked at their statistics that we had on ground. From there, we were able to make recommendations in those states. Through our advocacy, the policymakers in those states were able to actually buy into what we advocated for.
In Nigeria today, 111 women die every day during childbirth. That adds up to more than 40,000 deaths each year. Imagine a whole village or a small town of women dying every year as they try to give birth to children. The saddest part is that these deaths are preventable. Simple actions like family planning, seeing good and experienced healthcare professionals that specialize in obstetric care during pregnancy, and ensuring that all women deliver their children in well-equipped hospitals and health centers where emergency care can be provided if complications arise. The miracle of life into this world should be a thing of joy for families, not a time of sorrow. Working together, we can reduce maternal mortality in Nigeria. Join WHARC today to save life and reduce maternal mortality.
WHARC have also helped bring health services to pregnant women in rural areas and also provided a state-of-the-art health clinic in Benin where women can come and have their babies attended to by the best physicians using technologies that will reduce risk of any harm coming to either the mother or the child.
We have trained health providers across 18 states of the country, midwife nurses and midwives, obstetricians and gynecologists and doctors, to use new methods for managing the major complications of pregnancy. More importantly, WHARC has worked in the political domain to build the political commitment of governments to contribute more realistically to addressing maternal health. We worked with 6 state governments across the country to develop strategic plans of action for improving maternal health. And we also worked with about 20 state governments to introduce free maternal and child health services.
We've worked in 3 local governments of Edo State, the Orion local government, 3 places in Orion local government, to improve the quality of healthcare services there by rendering free maternal healthcare services.
Even the WHARC that made them to employ us, we have seen their good hand in this health center. At least they'll be helping us, trying to also assist the mothers with these their free drugs and the rest. Since they came now, even the statistics that we have, it has increased, because majority of them, they don't really like patronizing the health centers. They prefer delivering at home and the others. But since this program, at least there's a proof that there's an increase, and the programs really come to help them.
I register for here free, and I born for here free. Everything I give us here is free of charge. We are not paying any money.
Okay, at the hospital, the village here, everybody just like and we are people too. As we not dey go outside again. We need medicine, we go see them. Anything we need, we go see them. To travel, go outside again, we not dey go again. We come internet every week. They will change the baby, give us medicine.
WHARC has also worked to reduce the high rate of maternal mortality in Nigeria by addressing the issue of unsafe abortion, the leading cause of maternal mortality in Nigeria. In an effort to create more awareness about unsafe abortion, WHARC has commissioned a public service announcement which has been disseminated successfully.
Women in Nigeria are pregnant by their 20th birthday. 80% of unsafe abortions in Nigeria today are recorded among young adolescent girls. It is not easy being a young person in Nigeria today. But we can change the tide by providing life-changing, youth-friendly reproductive and sexual health education and services in our schools, places of worship, and other public spaces. Join Women's Health and Action Research Center, WHARC, to make the future bright for our young people again.
But in brief, WHARC has been doing training. We've been documenting the experiences of very many stakeholders on maternal mortality reduction. And indeed, our journal, which the WHARC Women's Health and Action Research also publishes, the African Journal of Reproductive Health, has been documenting various interventions on the prevention of maternal mortality across Africa. And a lot of programmers and policymakers are reading that journal and using them to develop policies and programs for the reduction of maternal mortality across the continent.
Female genital mutilation, or female cutting, is a dangerous cultural ritual that is still practiced in several parts of the region.
Female genital mutilation is a condition where women, the clitoral part of the women and also the labia part are removed as part of a cultural practice that is widespread in Nigeria. Female genital mutilation has no benefit at all. By contrast, it is harmful to the health of women. When they want to deliver, subsequently, a woman who has had female genital mutilation is more likely to suffer what we call postpartum hemorrhage, that is bleeding at the time of delivery. So the babies that are born to such women are most likely to have difficulties in coming out, and therefore they are more likely to suffer early neonatal death and so on and so forth.
WHARC has active programs in the area of eliminating or at least reducing this practice in Nigeria and have partnered all the organizations to conduct several projects in this area.
I want to say that with due humility, that WHARC was one of the first organizations to draw the attention of the inappropriateness, let me put it that way, or the harm that this practice is doing to our women. It was in 1998, 1999, we began a campaign against the practice of female genital mutilation. That campaign, indeed, led to the passage of the first law against female genital mutilation, which was passed by Edo State government. We know that several states, up to about 17 of them, subsequently have gone on to pass similar laws. We also know that a bill has also gone to National Assembly for a law to prevent the practice of female genital mutilation. And today we continue to advocacy, high level. In fact, recently, through an organization called Champion for Change in Africa that has given a small grant to WHARC to look at the impact of some of the things we'll be doing on female genital mutilation, the prevention of female genital mutilation, and to continue to see how the impact, how the law that has been passed in various states across the country has impacted on the prevalence. Generally, the awareness about female genital mutilation has gone up. It's gone very high in this country. So, and it's generally known now that your daughter's clitoris or labia part does not show any benefit. It's very harmful, and it can be deleterious to their health and social well-being.
One of the biggest health risks in Nigeria today is that posed by sexual transmitted diseases such as HIV and AIDS. Nigeria currently has high rates of STDs and an increasing rate of HIV and AIDS infection.
About 25% of persons infected with HIV/AIDS are are young persons between the age of 11 and 25. Over 30% of new infections every year still fall within this age group. Because of the peculiarities of the youth, especially at the adolescent period, they have a lot of energy. They are curious. They are trying to have an identity of themselves separate from what they've been told by their guardians or their parents. They are questioning some of the things that you've told them. So if they are not properly guided, mentored, and taken off distractions or wrong peer orientations, they could indulge, because of that experimental behavior, they could indulge in behaviors or learning attributes that can have implications for future.
Health experts believe that controlling STDs will be an effective way of reducing the impact of HIV epidemic in Nigeria. WHARC has been in the forefront of this fight and has recorded tremendous successes in this area. The youths are the future leaders of any nation, and a nation that wants to progress needs healthy and active young people. At WHARC, young people are taken seriously, and several programs are designed for this very important subset of the community. In designing activities and interventions targeted at young people, WHARC realizes that the traditional modes of outreach might not always work with this special group. As such, we have embraced techniques that get to the young people where they are and speak to them in their own language.
But for us to be able to have a handle on dealing with the social problems of reproductive health, we need this information also to reach, the end users, community gatekeepers, as well as policymakers, who often don't have time to read lengthy documents. So to that extent, we focus on communication. So right now, we are very prominent on Facebook, on Twitter, and on YouTube. And in the coming year, we are going to start a blog, a scientific blog, written in such a way that, people who don't have time to read the big documents can, the highlights of some of what we are doing and what other people are doing in the health can be provided in the blog, and they'll be allowed to provide an interface where comments can be made and so on and so forth.
Through these different channels, WHARC has been able to program successfully in the area of making young people aware of their reproductive health and rights. We've also tackled difficult social issues such as teenage pregnancy and other youth-specific issues. And our success has led to WHARC being invited to conduct these programs in partnership with governments and other organizations.
We work in partnership with government, otherwise we have no result. As an NGO, we complement government efforts. Not too long ago, MacArthur Foundation asked that we should supervise a project to stem teenage pregnancy in Ekiti State. We had to work with the state government, and we found it wonderful, very, very cordial, and we also saw the government very supportive, because we had to work in 3 local governments, with the traditional institution and with the government institution of those local governments. And we were very well received when we went to see the chairman of the local government and also the communities. So we've had a lovely relationship, and so we find it a positive direction to partner with the government.
As part of its mandate, the organization has, since inception, provided a platform for cutting-edge research that helps drive policy on reproductive health issues. A key output of the organization is the African Journal of Reproductive Health. From its first publication in 2007, the African Journal of Reproductive Health has today grown into the premier academic journal on reproductive health issues in Africa.
African Journal of Reproductive Health is an international journal that is focused on producing research articles on reproductive health, basically in Africa.
This is a flagship journal that talks about reproductive health as a developmental issue, and so on and so forth. So, and it is a multidisciplinary journal. So it's not just a medical journal, but it's also journals that are being used by social scientists, by anthropologists, by many other development workers, because it brings together the issue of all issues related to women, youth, even men, in a very holistic manner.
I have been a major fan of the WHARC, African Journal of Reproductive Health, over the last 15 years, and have enjoyed receiving copies of every issue that has been produced. And usually when I receive the copies, I'm always fascinated by the coverage of the issues that are discussed.
But with African Journal of Reproductive Health, you have research from all over Africa telling us about what they have done, how they are doing things, and how they are getting there, where they have had failures, why they had failures, and so on. And people learn. And so for us in the academia, it's a tool, it's a useful vehicle for us to say, look at what we are doing. So we get our articles published. At the same time, it's a useful vehicle for us to see what others are doing, learn from it, see best practices, and know how to better our place. So the African Journal of Reproductive Health is one journal that is so important, it's so vital.
Today, the journal has received so many accolades across the world. It's currently indexed across about 12 indexing companies around the world. It's published in 8 websites. And in 2005, the Nigerian University Commission, NUC, assessed several journals in Nigeria and came out with the verdict that the African Journal of Reproductive Health is the best journal in all disciplines in this country. And we've occupied that position to date.
The journal is indexed and abstracted in several key global databases on reproductive health and adolescent issues, including Medicars Medline, African Journals Online, Bioline International, Eurix Periodical, and African Books Publishing Records. The African Journal of Reproductive Health is also a member of Publication Ethics, an organization that promotes integrity in research publications. Prior to launching the journal, WHARC was already a recognized and well-respected research organization. Since its inception, WHARC has published more than 170 articles on women's health and presented papers in more than 100 local and international conferences. Other outputs include policy briefs, disseminated through conferences and workshops.
MDGs, the Millennium Development Goals, have come to an end, or a temporary end next year, 2015. And MG5 is the worst. Probably only 16% of the countries in the world will meet MG5. And that is what Professor Mahmoud Fatala said many years ago: maternal mortality is the scandal of our time.
WHARC's contribution to the body of knowledge that is shaping policy, program development, and service delivery is noteworthy. People, whether it is governmental agencies or donors, other NGOs, international development agency, actually use the evidence being generated out of WHARC.
For us in Planned Parenthood Federation, we have found partnership with several groups in the area of media, several groups in the area of research, several groups in the area of training, several groups in the area of service provision. Clinicians are in partnership with us, and WHARC has mainly covered our research partnership. Every research we have done in the last couple of years has to do with baselines, endline surveys, operational research. We have had to run to WHARC. If it were not for WHARC, probably we'll be sourcing that skill outside the country.
Besides disseminating research through the journal, WHARC also works to enhance the capacity of all the non-governmental and civil society organizations to be effective researchers. Through its numerous activities, WHARC helps train local health workers to design and conduct field studies on women's reproductive health issues in Nigeria and use the data obtained to update the skills and knowledge on the issues.
So our projects are done on field, and then we record them, we report them in our journal and other occasional publications. So it's not just publishing them in our journals and leaving them there without their getting to where we really want them to go. So because of that, we are now starting another way of doing our research and publications. to be able to carry this to the policymakers, and we're involving the media and so on. So that's what we've been doing essentially. So they're interrelated. We do research, we publish research, we advocate. We're engaged in advocacy as well.
WHARC's research has provided the foundation for targeted advocacy that has led to key interventions in the area of reproductive and adolescent health. Another important way that WHARC influences policy decisions is through several annual lectures it organizes. These lectures, which immortalize key figures in the reproductive health area, include the Professor Olukoye Ransom Kuti Memorial Lecture and the Abel Gubadia Memorial Lecture. Speakers at these lectures have included ex-presidents, state governors, and other important thought leaders who are invited to discuss critical issues in the area of reproductive and adolescent health.
2010, we passed into law our confidential inquiry on maternal deaths. We got our first report in 2012. And one thing that came out that was very interesting was that 94% of pregnant women who ended up losing their lives when they get to orthodox health facilities had previously visited a traditional birth attendant or the faith-based clinic. 94% of those who eventually did not make it in pregnancy had previously, before getting to institutions where there are trained, skilled hands, had actually visited these people. And what that means is that perhaps they are doing much more havoc than we can imagine.
Almost 20 years after the 1995 Beijing conference, the lot of women has improved all over the world. However, the work is not done. Despite the numerous achievements on improving maternal and adolescent health in the West African region, particularly in Nigeria, the work is still not done yet. As an organization, WHARC will continue to explore innovative approaches to make women in the sub-Saharan African region safe, especially in the life-giving areas of pregnancy and childbirth.